If you're over 60 and you ignore what I'm about to tell you in the next 12 minutes, you could lose function permanently. I'm Dr. Hannah McLeod, and I've been a urologist here in Toronto for over 30 years. In that time, I've seen thousands of men come through my clinic, and I can tell you this, the biggest mistake isn't what most guys think it is. It's not checking in with their doctor once a year or eating the right foods. The biggest mistake is believing that things will just keep working the way they always have, without any effort on your part. But here's the truth, and I say this with all the compassion I can muster. If you don't use it, you really will lose it. Today, I'm going to share 5 critical tips that most men don't know about. And tip number 3 surprises 90% of my patients when I tell them. So let's get right into it, eh? Before we start, I want you to understand something fundamental. Your penis ages just like your heart, your brain, and your bones. Most men don't realize this. They think sexual health is separate from overall health, but it's not. Everything in your body is connected. The same blood vessels that feed your heart also supply blood to your penis. The same nerves that help you feel sensation in your hands and feet are responsible for sensation down there. And just like you wouldn't expect to run a marathon at 70 without training, you can't expect optimal function without proper care. I've had patients in their 70s who, just by making these simple changes, regained control over their sexual health. And usually their overall health improved in other areas too. So stick with me here, because what I'm about to share could change your life. All right, tip number 1, proper hygiene, but not the way you think. Now, I know what you're thinking. You're thinking, Dr. McLeod, I've been washing myself for 70 years. I think I know how to do it. But hear me out, because this is where I see the most problems in my practice. Every week I have men come in with infections, irritations, or even serious complications that could have been prevented with the right approach. The issue isn't that men don't clean themselves. The issue is that they don't know how their body has changed with age, and they don't adapt their hygiene routine accordingly. Here's what happens as you get older. Your skin becomes thinner and more sensitive. The natural oils that used to protect you aren't produced as much anymore. This means that harsh soaps, the ones you've been using your whole life, can actually damage the delicate skin in the genital area. I've seen men develop chronic irritation, dermatitis, and even small tears in the skin because they're using regular bar soap or body wash that's too aggressive. So here's what I recommend instead. Use a gentle, fragrance-free cleanser, something you'd use on a baby's skin. I know it sounds silly, but trust me on this. And here's the important part. If you're uncircumcised, you need to gently retract the foreskin and clean underneath. Not roughly, not with soap directly on the glands, but with warm water and just a tiny bit of that gentle cleanser. Then rinse thoroughly. And this is crucial. Dry the area properly. Moisture trapped under the foreskin creates the perfect environment for bacteria and yeast to grow. I've had patients develop balanitis, which is inflammation of the head of the penis, simply because they weren't drying properly after showering. Now, one of the questions I get all the time in my practice is about the foreskin itself. Some men ask me, Doc, should I have gotten circumcised when I was younger? Is it causing problems now? And here's my honest answer. If you've maintained good hygiene throughout your life, there's usually no medical reason for circumcision in older age. However, if you're having recurrent infections, severe phimosis where the foreskin won't retract, or other complications, then we can discuss it. But for most men, proper hygiene is all you need. The foreskin serves a protective function, and as long as you're taking care of it, you're fine. Just remember, gentle cleanser, thorough but gentle cleaning, and complete drying. Do this every single day. Make it part of your routine, just like brushing your teeth. Your body will thank you. Tip number 2. Regular self-examinations and medical checkups. I cannot stress this enough. Most of my male patients are terrible at this. They'll get their car serviced every 6 months like clockwork, but they haven't seen a urologist in 10 years. Look, I get it. It's uncomfortable. Nobody wants to drop their trousers in front of a stranger, even if that stranger is a doctor. But here's what I tell everyone. Early detection saves lives, period. I've caught testicular cancer, penile cancer, and serious infections early because a patient came in for a routine check. And I've also seen cases where men waited too long, and by the time they came to see me, the problem was much more serious than it needed to be. So here's what you need to do. Once a month, do do a self-exam. I know this sounds awkward, but it takes 2 minutes and could save your life. Get in the shower where you're relaxed and the skin is a bit looser. Examine each testicle by rolling it gently between your thumb and fingers. You're feeling for any lumps, bumps, changes in size, or hard areas. A normal testicle should feel smooth and slightly firm, kind of like a hard-boiled egg without the shell. If you feel anything unusual, don't panic, but do book an appointment with your doctor. Most lumps aren't cancer, but you need to get them checked out. Also check the penis itself. Look for any new growth, sores, discharge, or changes in color. Any of these things warrant a visit to your GP or urologist. And speaking of visits, you should be seeing a urologist, or at minimum, discussing urological health with your family doctor at least once a year after age 60. We'll do a proper examination, we'll talk about any symptoms you're experiencing, and we'll run appropriate tests. This includes checking your PSA levels for prostate health, because prostate issues and sexual function are intimately connected. I've had so many men tell me, I didn't want to bother you with something small, and then it turns out to be something we needed to address months ago. Don't be that guy. Be proactive. Your health is not a botheration, it's a priority. And honestly, we've seen it all. There's nothing you can tell me or show me that will shock me. I've been doing this for over 3 decades in clinics across Ontario, from Toronto to Ottawa. Trust me when I say we're here to help, not to judge. Tip number 3, and this is the one that surprises most people. You need to maintain regular blood flow to the area. Now, what do I mean by that? I mean regular erections. I know this is where some of you might feel uncomfortable, but stay with me because this is critical. Your penis is not just skin and nerves. It's made up of special tissue called erectile tissue, which is full of tiny blood vessels. These blood vessels need oxygen to stay healthy, and the way they get oxygen is through blood flow. When you have an erection, whether through sexual activity or just spontaneous erections during sleep, fresh oxygenated blood flows through these vessels and keeps the tissue healthy. But here's the problem. As you age, spontaneous erections decrease. You might not be as sexually active as you were in your 30s or 40s. And if you're going weeks or months without any erectile activity, that tissue starts to deteriorate. The blood vessels can develop fibrosis, which is like scarring. The tissue can actually shrink. And this creates a vicious cycle where it becomes harder and harder to achieve erections, which causes more tissue damage and so on. So what's the solution? You need to maintain regular erectile activity. Now, this doesn't necessarily mean you need to be having partnered sex all the time. What it means is that you need some form of regular stimulation that causes erections. For many of my patients, this means regular masturbation. I know, this is something we don't usually talk about in polite Canadian company, but this is medicine and it's important. Regular sexual self-stimulation, even just 2 or 3 times a week, keeps that blood flowing and keeps the tissue healthy. Think of it like exercise for your penis. You wouldn't expect your legs to work properly if you never walked anywhere, right? Same principle applies here. Now, I had one patient, wonderful guy named George from Mississauga, who came to see me because he was having severe erectile dysfunction. He was 72, and he told me he hadn't been sexually active in any way for about 3 years since his wife passed away, God rest her soul. He thought that was just the way things were now, but when we talked about this principle of maintaining blood flow, he was shocked. He didn't realize that the lack of activity was actually making things worse. We worked together on a treatment plan that included some lifestyle changes and, yes, encouraging regular self-stimulation. 6 months later, he came back for a follow-up and told me he felt like he'd regained a part of himself he thought was gone forever. He even started dating again. This isn't unusual. I've seen this pattern dozens of times. And here's another thing. If you're having trouble achieving or maintaining erections, don't just accept it. Talk to your doctor. There are medications like sildenafil, which you might know as Viagra, or tadalafil, which is Cialis. These are safe and effective for most men when prescribed properly. There are also other treatments like vacuum devices, injections, or even surgical options for more severe cases. But the key is you have to seek help, and you have to maintain that regular activity. Use it or lose it isn't just a saying, it's actual physiology. Tip number 4. Nutrition and lifestyle factors that directly affect sexual health. What you eat and how you live has a massive impact on your sexual function, probably more than you realize. The The same things that are bad for your heart are bad for your penis. Why? Because both rely on healthy blood vessels. If your arteries are clogged with plaque from years of poor diet, high cholesterol, and lack of exercise, blood can't flow properly to the penis. And without proper blood flow, you can't achieve or maintain an erection. It's that simple. So let's talk specifics. First, cardiovascular health. If you're overweight, you need to work on getting to a healthier weight. I know that's easier said than done, especially as we age and our metabolism slows down. But even losing just 10 or 15 pounds can make a significant difference in your erectile function. Why? Because excess weight, especially around the belly, increases inflammation in the body and can lower testosterone levels. Both of these things directly impact sexual health. Get moving. You don't need to run marathons or hit the gym for 2 hours a day. Just 30 minutes of moderate activity most days of the week. Go for a walk around your neighborhood, maybe down to Tim Hortons for coffee, but then walk back instead of driving. Rake the leaves in autumn, shovel snow in winter, but take it easy, eh? The point is to get your heart pumping and your blood flowing. Diet is huge too. Eat more fruits and vegetables. I know I sound like your mother, but there's real science behind this. Foods rich in antioxidants like berries, leafy greens, and nuts help protect your blood vessels. Omega-3 fatty acids from fish like salmon, which we have plenty of here in Canada, are excellent for cardiovascular health. Limit your intake of processed foods, red meat, and especially sugar. Diabetes is one of the leading causes of erectile dysfunction, and it's entirely preventable or manageable through diet and lifestyle in most cases. I've seen men reverse their sexual dysfunction completely just by getting their blood sugar under control. And speaking of things to limit, alcohol. Now, I'm not saying you can't enjoy a beer while watching the Leafs play or a glass of wine with dinner, but heavy drinking damages blood vessels and nerves. If you're having more than 2 drinks a day regularly, you're putting yourself at risk. Smoking is even worse. If you're still smoking, please quit. Smoking constricts blood vessels and damages them over time. It's one of the worst things you can do for sexual health. I've had patients who quit smoking and saw improvement in their erectile function within just a few months. Your body has an amazing ability to heal if you give it the chance. And here's something else. Sleep. You need good quality sleep, about 7 to 8 hours a night. This is when your body produces testosterone. If you're not sleeping well, your testosterone levels drop, and that affects everything from your mood to your sexual desire to your ability to achieve erections. If you're having trouble sleeping, talk to your doctor. Sleep apnea is very common in older men, and it's treatable. Don't just accept poor sleep as part of getting older. Tip number 5, manage stress and maintain your mental health. This is probably the most overlooked aspect of sexual health, and it's absolutely critical. Your brain is your most important sexual organ. If your mind isn't in the right place, your body won't cooperate, no matter how healthy you are otherwise. I've treated countless men who had perfect physical health, good blood flow, healthy testosterone levels, but they couldn't achieve or maintain erections because of psychological factors like stress, anxiety, or depression. As we age, we face different kinds of stress than we did when we were younger. Maybe you're worried about retirement finances. Maybe you've lost a spouse or close friends. Maybe you're dealing with health issues or caring for an aging parent. All of this takes a toll. And stress triggers the release of cortisol and adrenaline, which are fight or flight hormones. These hormones constrict blood vessels and divert blood away from non-essential functions, like sexual response. It's your body's way of prioritizing survival over reproduction. Makes sense from an evolutionary perspective, but it's not helpful when you're trying to maintain sexual function. So what can you do? First, acknowledge that mental health is just as important as physical health. If you're feeling depressed, anxious, or overwhelmed, talk to someone. See a therapist or counselor. There's absolutely no shame in this. I refer patients to mental health professionals all the time, and the feedback I get is overwhelmingly positive. People tell me it changed their lives. Also, stay connected with others. Social isolation is a huge problem for older adults, especially men. Join a club, volunteer, take a class, go to the community center. Human connection is vital for mental health. Practice stress reduction techniques. This could be meditation, which I know sounds very West Coast, but it works. It could be deep breathing exercises. It could be yoga. Find what works for you. I have a patient who swears by his morning walks with his dog along the lake shore here in Toronto. He says it centers him for the whole day. Another patient took up woodworking in his retirement and finds it incredibly meditative. The point is to find something that helps you decompress and manage stress. And here's something I want to address directly because I get asked about it. Performance anxiety. This is very common, especially if you're entering a new relationship later in life or if you've had some difficulties with sexual function. You worry about whether you'll be able to perform, and that worry itself makes it harder to perform. It becomes a self-fulfilling prophecy. If this is happening to you, communication is key. Talk to your partner about it. Most partners are understanding and supportive. And remember, sexual intimacy isn't just about intercourse. There are many ways to be intimate and connected. Take the pressure off yourself. Sometimes just removing that expectation can solve the problem. Now, before I wrap up, I want to address a few specific questions that I see coming up frequently, because I want you to have practical, actionable information. One question I get is about morning erections or nighttime erections that are so firm they're uncomfortable or make it difficult to move in bed. If this is happening to you, first of all, it's actually a good sign. It means your erectile tissue is healthy and blood flow is good. But if it's causing discomfort, try changing positions slowly. Maybe use a pillow for support and give yourself a moment before getting up. If the erections are painful or last for hours, that's something called priapism, and you need to seek medical attention immediately. But normal nocturnal erections, even strong ones, are a sign that things are working as they should. Another common question is about sexual function after prostate surgery. If you've had your prostate removed, particularly for cancer, you may have damage to the nerves that control erections. This is a real concern, and it's something we discuss thoroughly before any surgery. But here's the important thing. There are still options. Medications can help. Vacuum devices can help. Penile injections, which sound scary, but are actually very effective and not as painful as you'd think, can help. And there are surgical options like penile implants for men who don't respond to other treatments. The key is to work with your urologist to find what works for you. Don't give up and don't suffer in silence. We have tools to help. So let me recap these 5 tips quickly because I want you to remember them. Tip number 1, proper hygiene with gentle cleansers. Thorough but gentle cleaning, especially if you're uncircumcised, and complete drying. Make it a daily habit. Tip number 2, regular self-exams monthly and annual checkups with your doctor. Early detection saves lives. Tip number 3, maintain regular blood flow through regular erectile activity. Use it or lose it is real. Tip number 4, nutrition and lifestyle factors. Healthy diet, regular exercise, limited alcohol, no smoking, and good sleep. Your penis and your heart need the same things. Tip number 5, manage stress and maintain your mental health. Your brain is your most important sexual organ. Look, I know some of this might seem awkward or uncomfortable to talk about. We're Canadians, we like to be polite and not make a fuss, right? But your health and your quality of life are worth making a fuss about. Sexual health is a vital part of overall health and well-being. It affects your confidence, your relationships, your sense of self. You deserve to feel good in your body, no matter your age. And the truth is, with proper care and attention, most men can maintain satisfying sexual function well into their 70s, 80s, and even beyond. I've been practicing urology for over 30 years, and I can tell you that the men who do best are the ones who take an active role in their health. They don't wait for problems to become crises. They make small, consistent changes. They communicate with their doctors. They don't let embarrassment stop them from getting help. And you know what? They're happier. They're more confident. They have better relationships. They feel more like themselves. So I want you to take action on at least one of these tips today. Maybe it's switching to a gentler cleanser. Maybe it's booking that appointment with your doctor that you've been putting off. Maybe it's having an honest conversation with your partner about your concerns. Whatever it is, take that first step. Your future self will thank you. And remember, aging doesn't mean giving up on this part of your life. It just means adapting and taking care of yourself in new ways. The penis you have at 70 can still serve you well, but only if you take care of it. Think of it as maintenance. You maintain your car, your home, your garden. Your body deserves the same attention and care. Thank you so much for being here and listening to this information. I know it's not always easy to hear, and it requires you to make some changes and maybe step outside your comfort zone. But I believe in you. I've seen thousands of men make these changes and improve their quality of life dramatically. You can do this too. If you found this helpful, please share it with the other men in your life. We need to break down the stigma around talking about these issues. The more we talk openly and honestly, the more men will get the help they need and deserve. Take care of yourselves, eh? And I'll see you in the next one.